Good morning, everyone. This is going to be a quick 15 or 16 slide introduction to medication administration. So, nurses' role in medication administration. This is for RNs and LPNs. Sometimes the RNs think they're sort of special on medication administration, but under the scope of practice and standards in Ohio, LPNs give quite a few medications. They even give some IV medications now. So it's your job to know what state you live in and what the rules are in your state. But to basically sum it up in four bullet points here, your job is to ensure safety and accuracy, ensure that you're following the provider's orders, and don't forget you're supposed to question any order you don't think is clear or makes sense. You're supposed to educate your patient on any side effects or any teaching he needs to take a medication, and you're supposed to monitor the effects and report any adverse reactions to medications. So let's talk about the 10 rights of medication administration. Right patient, right medication, right dose, right route, right time, right documentation, right reason, right response, right to refuse, and the right education. So let's start out up here at the top. The right patient. Make it a habit now when you walk in the room, say, can you tell me your name and your date of birth? If you've ever been at the hospital for any kind of testing, that's the first thing they ask you. They go, can you tell me your name, your date of birth, and do you have any allergies? They're making sure they have the right person. There's lots of people that have the same name, a lot of common names like Smith. Sometimes I meet a man who has a woman's name. You need to ask, and that date of birth is what makes that a part of what you're supposed to do. I went out to have a simple blood test drawn in a doctor's office, and my name Cynthia is very common from the 60s. And the lady came out of the where they call you back, and she goes, Cynthia, and another lady went to stand up. So that other lady had already been there, so I figured she was probably next. So I sat back down and I waited a couple of minutes and was looking at my phone, which is unusual for me. And here comes one of the nurses out, and she says, "Excuse me, is your can I ask your name?" And I said, "Well, Cynthia Weibel." And she said, "Can I ask your date of birth?" And I told her, and she said, "We were supposed to take you back." And I said, "Oh, well, I figured you'd ask the birthday when you got back." She said, "She's the other lady. When we went to draw her blood, she was kind of surprised." I said, "Well, I bet she was." You always ask, Can you tell me your name and your date of birth?" Even when you go to surgery now, when you go in, a lady says, before you get any medication, they say to you, one of the nurses says, can you tell me why you were here today? Your name, your date of birth, and why you're here. Because if you're there for a total right knee and they're going to be doing a shoulder, that's her chance to catch an error right there. Okay. Number two, the right medication. If you haven't taken Pharm yet, and those of you that have, some of these medications have similar sounding names, and they're you know what? If you know the right medication, you check it when you pull it out of the either the Pyxis or the drawer. I check it, then I check it with the computer, and then I check it again at the bedside. I also do the dose and the route and the time then. Okay. One thing that I also do that you look on here is am I giving it for the right reason? If I pull out an order for a blood pressure pill and I'm not sure that this person has hypertension and I had a blood pressure this morning that they were not hypertensive, am I giving it for the right reason? Okay. A right response means I want to make sure that they respond effectively to the medication. And I want you to understand something. People have a right to refuse medication. Okay. Inevitably, you're going to see it in a testing program, and inevitably, you're going to see it in your real life nursing career. And a person says, I don't want the red pill anymore. I don't feel well on it. If they are alert and oriented, they have autonomy. Autonomy means they have the right to make a decision, and so they have the right to refuse medication. And the last one on here, right education. Once I started giving pharmacy education to you guys in a little more heavier in a little in a classroom setting, I noticed that some of you say, "Well, no one ever told me that." You have a right to know how to take your medication and what the side effects are and how to take it properly. And I do see nurses kind of fall down on the job on this. I'm not going to lie to you. And especially when I don't tell them I'm a nurse and they're giving a medication, I like when they do it right and correctly. I'll give you an example: taking an NSAID after having some pain, arthritis pain. One nurse doesn't say anything to me. The other one says, "No, I need to talk to you. You need to take food when you take this NSAID," and that is a teaching point that goes with NSAIDs. So you can tell the nurses are kind of on top of their game, and some of them that are not on their game. So let's talk about the types of medication orders. The first one is routine orders, and that's a prescription that is followed continuously until it's canceled by another order. This would be, let me give you a medication you might know. Let's see, levothyroxine 100 micrograms every day for hypothyroidism. You're going to be taking it every day. It isn't given stat. It isn't given for any other reason. Unless we would cancel it and change that order, you're going to take it routinely every day. The second one here is PRN. PRN means as needed. It's a Latin like pro nata, as needed. So this allows a medication to be given based on symptoms like pain. So an example would be acetaminophen, 500 milligrams, 1 tablet, PRN Q6 hours. Okay. All right. And so you go down here. One-time stat orders means a type of one-time order. It's given immediately or without delay. And then there's a single order. You can do a single one-time order. That means there's a single one-time medication administration. They may say give acetaminophen 200 milligrams one time now for headache, and that means just give it once. Okay. The last one here says a standing order. Now, it's kind of an order set of protocols. That's like a standard prescription nurses can do in certain circumstances without contacting a provider. That would be something like for managing hypoglycemia. Any of the nurses that take any of Dr. Jones's patients who have a hypoglycemic under 70, nursing staff may give certain types of sugar or whatever until the blood sugar goes up over 100. I then contact you because obviously you're going to give the glucose before. You're not going to call the doctor and ask, should I give them glucose? You know they're hypoglycemic. You're going to go ahead and treat them. You don't see standing orders much anymore. You used to see them a lot more. I think it's a legality thing, but it comes out there's a standard. Everyone on this floor receives this particular product when they're hypoglycemic. So that would be that example. So let's talk about the routes of medication administration. The first one is oral, which is abbreviated PO. That's a medication that's swallowed, either a tablet, a capsule, or a liquid. And then you're going to see sublingual on the list and buccal. So let me let you know about those. So sublingual, okay, and it's abbreviated SL. That's when a medication is placed under the tongue to dissolve, and the other medication, buccal. A buccal medication is a route of drug administration where the medication goes between the cheek and the gums in a little pouch, and it gets absorbed into the bloodstream through the lining of the mouth. Make sure that you understand the difference between those two. Okay, they can be a little tricky when you read them if you're reading the orders for medication, or even when you're taking a test. You got to make sure those are actually two different things. Sublingual being under the tongue, and the buccal being in that pouch between the cheek and the gum area. There's a good picture in your reading material. Rectal is here. That's when the medication is given via suppository or enema. You also have a topical and transdermal here, and that would be a patch. Okay. Inhalation is when the medication is put through the lungs, like an inhaler or a nebulizer. The term parenteral is referring to anything that's given that's not on this list. That would be an IM, intramuscular. IV, intravenous, sub-Q is subcutaneous, and ID is intradermal. And of course, we also have rectal and vaginal administration of medications. So, common forms of medication: tablets, capsules, liquids, creams, ointments, patches, injections, suppositories, inhalers. They have a ton of way to give medications, and you've unfortunately got to know about all of them. So I made this slide myself from material I had. They actually give you usually a PowerPoint with a book, but it's just stuff from the book. And you guys make the mistake, you don't realize what's super important, that they're going to give you concepts that you need to understand to answer things in a question, and of course to deal with what happens in real life. So these are rules of medication pass, and I say don't ever break these rules. I sometimes break rules. I'm a human being, or I don't break any that are going to cause somebody to not have a good outcome. Okay. So I bullet pointed these. If a patient says to you, I don't know what this pill is, I do not take this, what do you think you're supposed to do? I want you to think for a second. So listen to me. If a patient says he doesn't take a pill, then I go and I check that. Okay. My experience has been, and other nurses' experience has been, that usually the patient knows what he takes. He may not know the name. He may be just giving it by color, but he may sometimes be correct and was told he doesn't have to take a certain pill anymore. You're here, you're at a drug cart of some kind, you're at a Pyxis of some kind, running around, and the patient may have been told he doesn't have to take a certain pill anymore, and you didn't get the order, or things aren't complete. So you always go back and you check if he tells you that. Number 2, what to do if you drop a pill. I kind of feel like that this is common sense. You need to get it thrown away. and you need to get a new pill. Okay. If it's a narcotic, that's different. We'll talk about that in class. We're going to do the narcotics during class and talk about how to handle that. Okay. But I don't want you giving me a pill that you dropped on the floor. I wouldn't want to give your loved one one, and you always treat people the way you want to be treated, so you got to get another one. So what do you do if you don't understand a doctor's order or what the order is, or the order looks not correct? It looks like it was for 10,000 units of something that you know that isn't true. You're going to have to get off your butt and go down there and call. I get my fat sassy butt is going to have to find somebody and find out, says you wrote an order here that isn't clear. Now the hospitals use computerized entry for the doctor's orders now, and so there's not as many problems, but even then I still read it. If it doesn't make sense, I don't give the pill. Okay. I right away ask the patient their first name, last name, and does the order match the patient. I always take my medication and do my 3 checks. Remember, 3 checks. I do them when I pull them out of either the Pyxis or the drawer. I do them up at the computer screen. I read it back, and then I do it at the bedside when I open it for the final open. Okay. Does the medication label match the order? Does the strengths and doses match? And is the proper time interval has passed, and does the route match the order? You make sure that everything matches. All right. So this is just rules, and think about how many test questions we can give you about the rules of medication pass. You guys are, well, we don't know what's on the test, and you need to give us a study guide. No, I don't. I gave this to you. They're going to ask you situations that are real life like this. These are real life situations. Can a patient refuse a medication? Yes, he can if he is alert and oriented. Your option would be to document that. I usually notify someone, let someone know that the patient's refusing the medication for whatever reason. But it's all right for a patient to refuse the medication. They have that right if they are alert and oriented. Some more concepts that apply to like your test questions and to your nursing life. The first thing is you have to assess and make sure people are able to swallow pills if pills are ordered. If they're having swallowing problems, you may need to crush a pill. All pills are not crushable. You have to find out in your literature, either on your computer screen should pop up something, or you might have to use your phone or a book, use an old-fashioned book, and find out if a pill is able to be crushed, because we never crush an enteric-coated or extended release medication. Okay. So number 2, you want to make sure, are they NPO or are they able to take their pills with a sip of water? Usually the doctors will tell us it's okay to give the pills with a sip of water. You do have a pill cutter and other little tools you can use, a little pill crusher and things you can use in your drawer usually, but those are things that you have to kind of take into consideration when passing meds. Parenteral medication administration involves injecting medications directly into body's tissues and circulatory system, bypassing the digestive system. That term parenteral has got some sort of Greek background to it, but this method of medication pass is crucial for various reasons, especially if you need rapid drug action, when you can't do oral administration, or if the medication is known to be poorly absorbed through your GI tract. So some types of parenteral medication administration. The first one that's on here is intramuscular, IM. That means the medication is injected into a muscle such as the deltoid, ventrogluteal, or vastus lateralis. When you get to that section to know, you need to all know where those muscles are and be able to tell your instructor where they are. Okay. The second one here is subcutaneous or sub-Q. It's a medication injected into fatty tissue beneath the skin. That would be, an example would be insulin. The next one on here is intradermal. That's a little injection that goes just under the top layer of the skin. Tends to be for allergy test or a TB test. If you've had the TB test here for school, that was an intradermal. And you need to keep in mind, aseptic technique is critical. Aseptic means sterile. You need to make sure everything that you wipe off is with alcohol and clean. This has a risk here because we're putting it directly into the body. Some bullet points on documentation and legal aspects. You document immediately after you give the med, not before. You put the time, the dose, the route. If there is an error, you report errors following your facility policy. Think about this. What do you do first, though, if there's been an error? Who am I worried about first? I'm worried about my patient. I check my patient first. If I find an error, I would commit an error. First person I do is I check the patient and make sure he's okay. There's a lot of paperwork involved in an error. You have to fill out an incident report being a document that goes to the legal eagles at the hospital. You don't put it in the chart that you filled out, but you tell exactly what happened. So we can make people better, okay? So we can stop errors. There's a lot of errors, and nurses, I'm not gonna lie to you, they tend not to say anything because you don't want to get your friend into trouble or anything. But it should be always about safety. We shouldn't have to. This shouldn't be any kind of an issue. Okay, you never chart before you give the medication. You chart after the patient takes it. So, what do we mean by patient education? Well, the patient needs to know the name and the purpose of the medication, how and when to take it, side effects, and what to do if they miss a dose. So, medication errors. Some of the common causes are being distracted, fatigue. A lot of errors occur after 3 o'clock when nurses start to get tired. Illegible orders and they don't know what the order said and they thought it said something else and you gave the wrong med. One thing that they do now is this computer entry orders that most hospitals have under Epic, but Epic's not the only company that uses the computer systems for charting. There are other companies across the country. So how do you prevent? You verify, I triple check. You use your MAR when you give medication. Slow down, where you got to be. And we never open a pill and put it in the drawer. You're not supposed to do that. I'll never forget this. I was teaching this information to some students, and they must have been going to a nursing home or some type of facility where they gave a lot of meds. They filled 40 cups on a tray to give 40 people medications before they gave them and charted them and said, tell this to your instructor. This is how we do it in the real world. I'm sorry. There may be where sometimes you learn something in school and it doesn't seem the same when you go out to work. But that is just the most unsafe thing I had ever seen. And I told the students who brought me back the picture, I said, this guy may think he's a smarty pants and he may think he's telling me something as a nurse instructor, but all I could see was he's possibly going to give my loved one the wrong medication. So what do you do if there has been an error? You're supposed to report it immediately. And most importantly, what you do first is monitor the patient. Okay. That is absolutely, we want to make sure our patient is okay. So in summary, to prioritize, we want to prioritize safety, accuracy. We want to follow the 10 rights. Make sure you know your medications, document and report accurately and correctly. So please bring your questions and discussion over to class when you come, and remember all the rules in Medication Pass are must know. And this is for any student that's listening to this. They don't have to be in my class. You need to do your Medication Pass and try to do it the proper way. All right. Have a great day, guys.